I thank the organizers of the AIOC committee for providing this great opportunity in presenting my innovation in this forum. My innovation is giving life to surgical training through GoPro Live. This is a GoPro camera-based surgical video recording system. As all of us know, the surgical training where the ophthalmology is a combination of both medical and surgical field, and to excel, we need to have a good exposure in both surgical and medical field. Surgical training for residents and fellows is inadequate in some places, and it is further complicated in this COVID times because of the decreased patient flow and reduced community outreach activities. As role of surgical videos in training, we can use these surgical videos as a basis for video coaching. It can also be used as a self-assessment and evaluation. Video-based assessment can be done of the residents and fellows. It can be used to document, audit, and quality improvement, and significantly to improve surgeon performance. The traditional video recording devices available, the problem is they're fixed and they're not able to shift in all the other theaters, and we cannot give a live voiceover when the surgery is happening. Sometimes there's a difficulty in recording and accessibility of this video, and usually proves to be costlier. So we introduced this a modified GoPro camera-based surgical video recording system.
GoPro is a compact action camera mainly used.
Is the audio heard, sir?
Yes.
By sportsmen and people involved in extreme action. With a dedicated app for both Android and iPhone, the GoPro camera can pair perfectly with any mobile device to access a variety of features. With inbuilt Bluetooth and Wi-Fi, the users can go live. GoPro has inbuilt speaker through which the user can give voiceover to what is getting captured in the camera. We have mounted GoPro camera to the side scope of the surgical microscope, which is paired with a tablet through the GoPro app. This video recording system has turned out to be extremely useful during the COVID times. Learning from the experts. When an expert surgeon is operating, the surgery can be live streamed as in Facebook or YouTube, which can be watched by the junior surgeons through their smartphone or laptop easily at their own place. Since GoPro comes with an inbuilt microphone, the operating surgeon can give live commentary of the steps being performed.
The exercise should be performed under high molecular weight visco.
This will greatly benefit a larger group of students. Guidance from the seniors. When a junior surgeon is operating, the live video streaming can be used to get guidance from the trainer or any senior surgeon. Junior surgeon can present their problems through the GoPro microphone, and the trainer can keep adding comments in the comment box, which can be conveyed to the operating surgeon by the assistant. Even though a telephonic conversation can also be used to get guidance from the trainer, the discussion can negatively disturb the patient who is getting operated. Telementoring. Once the initial training is complete and the trainee has started performing surgical technique independently, monitoring of the surgery by the mentor stops at that stage. Mentor reviewing the trainee's surgical performance after a certain number of independent cases can greatly increase the trainee's efficiency. Many a times the mentor may be staying far from the trainee's place, and frequent travel to guide may not be practical. GoPro recording system can help in telementoring either during live streaming or reviewing the surgical videos at a later time.
So this is one of the
GoPro is
This is one of the video recording which we did with the GoPro, where you can see that surgeon is giving voiceover while operating.
In young patients, mature cataract, the nucleus is very brittle. No? It is like a cookie almost. So here you don't have to try to chop. These are good cases to practice.
And these videos we can stream it through a closed Facebook group where only few people of the members in the Facebook can watch the video live. And this will be stored for future viewing also. So this will be there in the Facebook, and whenever the resident or a fellow becomes free, they can go back and see this video which is there on the Facebook. And also the evaluator or the trainer can also see it whenever the opportunity is available. And we carried out to the next level where every evening we discuss with all the junior surgeons through this Facebook live recording. So when we evaluated, it found that most of them like this system. They almost gave 22 scores out of 25. And finally, it is simple and easy to use, a cheaper alternative for a high quality surgical video recording system, which can also be used for live streaming. Thank you.
That was an excellent presentation, Dr. Pavan Kumar.
Thank you.
Dr. Prashant, are you here? Dr. Prashant Bavankule? Dr. Ravindra sir, would you like to comment on his innovation? Dr. Prashant is here? Okay.
Yes. Thank you, Anaga. Pavan, this was a nice innovation and a cheap alternative to what we can do thing, as well as the fantastic use of telemedicine in this COVID times. But would it be a replacement to the existing pattern of teaching, like a video-based, which is available now on online everywhere? Does it give the feel of a live session?
Yes, sir. Two things I want to tell. So one is, as senior surgeon is operating.
Can't hear you.
Junior surgeon. Yes, sir. Can you hear me now, sir?
Yeah, loudly. Yeah.
Yes, sir. There are two things which I want to highlight here, sir. The first thing is, when the senior surgeon is operating, we don't have all the residents to be there in the operation theater to observe and learn from the senior surgeon. They can be at any of the choosable place, and they can watch it, and the surgeon can give a live voiceover. Second thing is, if the junior surgeon is operating, once his training is finished, he's operating independently, the evaluator or the trainer can sit in his OPD and can see the video, and he can always give a comment, so that he doesn't have to be there with the trainer at the trainee at the point of time. Okay. He can be in the same place or he can be different place.
Nice.
This can be used even post-COVID time also, sir. And the overall cost, along with the C-mount, along with the cable, everything comes somewhere between 2 to 2.5 lakhs, which is way more cheaper than the traditional video recording system, which costs around 10 to 12 lakhs. And the quality of video we get is around, we can even record into 4K, 1080p easily, sir. We can just change it, sir.
Okay, great. Thank you.
Where is it available?
Madam, now initially we use it, we were doing it in experiment by buying a GoPro camera and then doing all the adjustments. Now it is sold through RO Lab and it is commercially available.
Thank you. Dr. Ravindra sir, your comments, please.
Yeah, I think GoPro is a well-known camera system used by professionals. They use a lot, especially in sports and such activities. What will be the difference, like when you present one video on GoPro and the other one on regular, 4K or high resolution, HD video? Can you make out which is which? Is there a resolution difference? Is there a brightness? Or all those, does it give the same kind of?
Yes, sir. Yes, sir. Yes, sir. It gives almost the same resolution. Very difficult to make out which is what. It's as good as our Sony live recording system. One more advantage is the video what we get output is of a lesser memory size when you compare to the traditional one, where we get 4 GB, 8 GB, 12 GB. But this is not like that. You get it somewhere around 800 MB, 1 GB. So that it's very easy to upload in Facebook also, so that they can see a live streaming. And we can easily store it, record it, and we can transfer it very easily. So when you compare to the traditional system.
Editing is possible on the conventional video editors?
On the GoPro, it is not possible, sir. We can just transfer to any of the software. It's available in both MP4, MOV format, and we can easily edit it, sir.
Fine. When the voice was coming, I think there was a lot of disturbance from the surgeon, from the operation theater.
Yes, sir.
Is it possible to attach a microphone to the camera and reduce the noise?
Yes, sir. There is a facility available, but the problem is to have a wired. It contains that 3.2 the plug which comes. So it's very difficult to attach a earphone and then attach it to the surgeon, because the camera is attached to the microscope. It's very difficult to move around the microscope. And the only thing is, you can just switch off the fan if it is available, which is working. You can just talk the surgeon a little louder.
Okay, good.
Disturbance is an issue. I totally agree with this.
Great. Lovely presentation. Dr. Sushmita Kaushik ma'am, any comments at the end of our session? Is she here?
Yeah, I'm here.
Yes,
so
ma'am.
enjoyed the whole session actually, and I had almost the same question that when you're transmitting this, have you, as we all asked for all the others, have you validated this to the usual camera with the thing? I understand the idea is that you can transmit it live, but with the many institutions now have facilities to transmit live, even if you're not in the OR. So have you compared that to any of the existing video transmissions that we have?
Thank you so much for asking this question, madam. I wanted to highlight one thing, madam. Here, the system consists of two things. One is the camera and there's an iPad. There are no other cables attached. So it is very easy to connect. One. Second thing is, when we are in our own hospital, we recorded both the GoPro videos and the traditional videos, and we presented to the same operating surgeon and the evaluator randomly. And we asked which one is better. All of them scored GoPro video as a quality wise compared to scored better compared to the traditional video recording system, and with this evaluation also. And we are writing a paper on this also. I mean, few more months, maybe we'll get it out for publication also.
Yeah, and in one limitation, I think you should add, you must have high-speed video Wi-Fi, which is going to be another problem with,
maybe
with transmitting high-quality videos across. That's something that you need to keep in mind. And another suggestion: have this on the slit lamp as well. I said have this on the slit lamp so we can do gonioscopy.
Yes, madam. We are trying that attachment also. Yes, madam. We can do that also. That needs other adapter for slit lamp. We are working on it, madam, but I'm not able to exactly tell you the output now.